attention. Focus. Have you ever found yourself saying these things to someone, or maybe someone had to work that hard to get your attention? If you answered yes, or you have no idea what I just said, you could have ADHD. There have been more than twice the number of diagnosed cases since 1990. This could be due to a lack of diagnosis in previous years or from a possible surge in the disorder since the 90s. Even though it's one of the most researched mental health disorders, the cause is still unclear. ADHD can be so severe it could prevent you from completing your normal everyday tasks. And while we don't know what causes it, we do have ways to treat it. Today, I would like to share with you what ADHD is, what signs to look for, and how it can be managed. First, let me start by explaining exactly what ADHD is. According to the National Institute of Mental Health, Attention Deficit Hyperactive Disorder, ADHD, is a disorder marked by an ongoing pattern of inattention and/or hyperactivity, impulsivity that interferes with functioning or development. ADHD is a disorder that can disrupt your everyday life and make even the simplest task, like putting words on paper, seem near impossible. You may be wondering if ADHD looks the same for everyone. It's actually categorized into 3 main types. Each type is explained on the Johns Hopkins Medicine website. The first and least common one being stated on the website is the impulsive hyperactive type. It is characterized by impulsive and hyperactive behaviors without inattention and distractibility. These patients struggle to sit still, but they're able to stay focused long enough to complete a given task. The next type mentioned is the inattentive, distractible type. This type of ADHD is characterized predominantly by inattention and distractibility without hyperactivity. The opposite of the first type. These patients aren't impulsive or fidgety. They do struggle to stay focused on a task. The last and most common type of ADHD listed on the website is the combined type. It's characterized by impulsive and hyperactive behaviors, as well as inattention and distractibility. And even though there's not an easy type, these poor patients really struggle. They're dealing with both sides of ADHD. Now that you know what ADHD is, and you're aware of some of the signs, let me tell you how it can be treated. On the Help Guide website, it states that medication can help reduce symptoms of hyperactivity, inattentiveness, and impulsiveness in children and adults with ADHD, attention deficit hyperactive disorder. There are stimulants and non-stimulants according to the Mayo Clinic. Stimulants appear to boost and balance levels of brain chemicals called neurotransmitters, while non-stimulants work slower than stimulants do, but these may be a good option if you can't take stimulants because of health problems or if stimulants cause severe side effects. Another treatment option for ADHD is psychotherapy. In an article by Laura Honos-Webb in Psychology Today, it states psychotherapy can increase the levels of functioning for children and adults who struggle with ADHD. Many people can have all symptoms of ADHD, but have successful careers and relationships. To conclude, today I have explained what attention deficit hyperactive disorder is, what the symptoms are, and a couple of ways to treat it. And even though it's one of the most researched mental health disorders, the cause is still unclear. The severity of ADHD can be so intense, it can be the reason of you not being able to live a productive life. While we don't know the cause, we do have ways to treat it. So if you or someone you know is struggling with these symptoms, it may be worth your time to talk to your healthcare provider about the possibility of you having attention deficit hyperactive disorder, ADHD. Thank you.